this presentation is about clinical study designs and assignment of levels of evidence. So to start with, the topic looks a bit weird and something mind-boggling, but it's something which we hear day in and day out. So the words like randomized control trial, case reports, prospective cohort studies, meta-analysis, systematic reviews, these are nothing but different types of study designs. Okay. And second thing is, what do you mean by the assignment of level of evidence? So again, the words look complicated, but it's not as complicated as we would think. For example, if you want to read something about post-tubercular kyphosis, so you search the literature and you get different types of publications. So one is a closing opening wedge osteotomy, surgical procedure for kyphosis. Then somebody has described some short-term analysis of kyphosis in young children who had tuberculosis. Then somebody has studied it over a period of time. They have studied the natural history of post-tubercular kyphosis. And somebody has written a review article. So you get all these publications when you search. So if you classify them based on the type of study design, so the first will be a case report, the second will be a case series, the third one is a prospective cohort study, and the last one is a systematic review. Now when you want to take the best information from the different articles, then you note the strength of the evidence from which the article has come from. So this is nothing but so each of these study designs have different levels of evidence based on which you have strength of the information. So why do we need to know about clinical study design and levels of evidence? So for selecting the exact study design is the key to the success of your research. The study design selection is based on your research question. So from this study design, we can know the level of evidence of a particular study. It can either be the strength of a published paper, or we can decide how strong your study is going to be. So from your research question or whatever thesis you are going to study, you have a research question based on which you decide which is the best study design to take your study forward. And from your study design, we have the level of evidence. So all these three things are interrelated. So we have this broad classification of study designs. One group of studies are called the analytical studies, also called as the quantitative studies. The other group of studies are called descriptive studies. The other names for it are non-analytical or qualitative studies. So coming to the first group of studies, the descriptive of the non-analytical studies. So descriptive studies, as the name stands by, the studies are just going to describe something. They are not going to analyze the cause-effect relationship. So it just gives a picture of what is happening in the population. For example, it could be a case report or a case series or a cross-sectional surveys. So from these studies, we can get the frequency of several factors and hence the size of the problem. For example, the prevalence of disease or the incidence of disease in a particular group of population. And it doesn't try to quantify any relationship. So for example of a descriptive study is a cross-sectional study. So by definition, it is the observation of a defined population at a single point of time. So when we are studying it in a single point of time, both the exposure of the risk factor and the outcome, that is the disease, have already occurred in that population. So it is usually the first phase of most epidemiological investigations. For example, if you want to study the incidence of osteoarthritis in an elderly population, you go to an old age home, so you study all the residents of that old age home and see how many have osteoarthritis knee. So if you think obesity is a risk factor causing osteoarthritis, so both obesity has already been existing there and both the disease has been existent there. So the second group of descriptive studies are the case report or the case series. So here it is a single report of a single rare or a small series of patients with an interesting disease or an interesting outcome. So here we don't have a control group, but these studies are important to formulate hypotheses for future analytical type of studies. The third group of descriptive studies are the editorials and opinions. So any journal, if you open the first page, will have an editorial by the editor. So this is usually put forth by experts in the field. So usually these are not validated, they are personal and experience based by the eminent surgeons, but they are very helpful in planning further studies. So far we have studied the descriptive studies in which we had 3 or 4 subtypes. Now we are going to study what is meant by an analytical study. So analytical studies are quantitative studies. That's the other name for analytical studies. They quantify the relationship between two factors. So basically they are going to study one intervention or an exposure based on which the outcome, that is the disease. So these are found to designed to study the strength of association between an exposure and the disease. So these analytical studies are subclassified into two types. One is the experimental one or the observational one. Not very complex. So if you are going to introduce the exposure or intervention where you are the active researcher and then you are seeing the outcome, then it comes as an experimental study. For example, randomized control trials. The observational studies, the exposure has happened automatically and where you are working passively is to study the disease. So again, coming to the algorithm, so qualitative and quantitative studies, qualitative or descriptive studies we studied 4 times, and analytical studies we classified as observational and experimental based on whether you are going to give the exposure or whether the exposure happen automatically. So coming to the first group of observational analytical studies, case control studies. So we are going to study in detail in each of them, so I will just give a brief gist of it. So this is a study design used in establishing the strength of association between a disease and a suspected risk factor. So why we are putting a suspected risk factor? Because we don't know only the disease has happened. We are going to from the study we are going to analyze whether the risk factor is really the cause of the disease. So this picture is very important to learn. So here the question mark gives the exposure, which we don't know whether it is the real cause for the disease, but the disease has happened already. So where exactly the researchers is getting involved is after the disease has happened. So the case control studies typically begin with the outcomes, that is the disease has already happened. So we do not follow the people over a period of time. So these are retrospective studies. They choose 2 groups of people, one with the disease and one without, and interview the groups or check their records to ascertain whether these different factors they were exposed to was the cause of the disease. So for example, so this study, so effectiveness of rotavirus vaccination against childhood diarrhea. So here the diarrhea has already happened. So the researcher starts from below. So analyzes how many of the children with vaccination had diarrhea and how many without vaccination didn't have the diarrhea. So the second group of observational studies are called cohort studies. So this is a clinical study in which the people have received the particular treatment or the exposure of the risk factor has happened. Now they are going to be followed up prospectively to study how many of them are going to get the disease. So remember that picture in your mind. So now the exposure has happened. Now the researcher enters into the study. Now he follows them prospectively to analyze whether the disease is happening in which group of people. So start studying the groups after the exposure has happened. Document the occurrence of the disease over a period of time. So it gives the incidence of the disease and relative risk of developing the disease. So a very popular example is the Framingham heart study, which we have heard many times. So the study was started in a small town called Framingham in the year 1948. So they prospectively followed 5,127 patients over a period of 20 years. So every 2 years they studied the patients to see how many of them are going to develop a cardiac event. So based on the risk factors like how many had hypertension, how many were smokers, how many had hypercholesterolemia, they found out these are the risk factors related to the development of heart disease. And they also found that patients who were physically active didn't develop cardiac disease. So the second group of analytical analytical studies are the experimental studies, where the researcher is going to give some intervention. So again, these are prospective studies. The typical example is a randomized control trial, where one group of patients are randomly assigned an intervention and the other group randomly do not have the intervention. So this is a typical study pattern. So we have a study population, then we have specific inclusion and exclusion criteria. We push out certain number of people as non-participants because they don't fit it into the criteria, they don't want to participate in the study. then we select the potential participants, then we randomize them. Some will have the intervention, some will not have the intervention. Then there are different levels of blinding, then we have the outcomes. So this is a typical example. We have a group of cancer patients. So we want to know whether one chemotherapy drug is going to work for that particular cancer. So you randomize them, give treatment for one group and give placebo for the other group. And then you follow them prospectively and find out which is working. So this is a broad chart: analytical, descriptive, observational, experimental, and we saw what is what. So these are called as primary researchers. Primary research means where the researcher actively goes and does the research. There are one more group of research is called as a secondary research. So there are two types in the secondary research. One is a systematic review and meta-analysis. So these are very smart people. They don't actively do the research. Somebody has already done the research. They collect the data and get the best results out of it. So first one is a systematic review. So here the researcher has a particular clinical issue to be addressed. So he uses a set of specific criteria, and we have an organized method of locating, assembling and evaluating a large body of published peer-reviewed literature on that particular topic. And when we collect all the literature, we have a critical method of assessing the literature to conclude on the results. So it looks easy to get somebody else's research, but it is actually one of the toughest and most methodical way of analyzing. So for example, the Prisma has given a set of guidelines, how to have the objectives, what eligible criteria exactly used, what are the informational sources you checked, how many PubMed literature, how many Google Scholar, how many CINAHL, how many Scopus, all those databases, from how much paper you took, how many citations you read. It's quite a tough process to study. So for example, in this publication, this is a systematic review on the role of conservative management of patients with an osteoporotic fracture. So this researcher has comprehensively analyzed 7 databases. So he has used a list of keywords: osteoporosis, kyphoplasty, vertebroplasty, cementoplasty, and about 9 or 10 keywords. From 1966 till 2011, all the published literature relevant to the topic has been retrieved by the researcher. So totally he has read 1,548 citations. Based on the inclusion criteria he has studied, then selected 13 studies. So it's quite a complex task. So the second group of secondary research is called meta-analysis. So as we all know, there are some diseases or some procedures where the results from one study may not have enough power to say strongly that it is a very good intervention or a very bad, not a very good intervention. So in meta-analysis, what we do is we combine the data and results of many similar studies. Then we have a statistical process to systematically assess the results to derive strong conclusions about the paper. So the best meta-analysis is one where randomized control trials on that particular study is retrieved. All the results from these 7 or 8 papers are combined together to get the result. So for example, again for osteoporotic fracture, there is a raging fight between people do kyphoplasty and vertebroplasty. So both feel that both are good. So one has done a meta-analysis. So they studied 10 studies which met the specific inclusion criteria. So each of the studies will have only 60 or 70 patients. But when you combine the results of all the patients, now you have 783 patients. Now whatever results you are going to have will have better strength. So they found that some factors are significantly different and some were not very significantly different. And they found concluded that both are safe and effective procedures. So this is a broad final slide. So clinical study designs classified as analytical or quantitative ones, and descriptive or qualitative ones. From descriptive we have 3 or 4 subtypes, and in analytical, based on whether we are going to intervene or not, we are classifying as observational and experimental. And other group of research is a secondary research based on data published previously. So if you want to know, if you're studying a paper and want to know what exactly is the study design, so start with this algorithm. So just see whether the investigator has assigned any exposures. So if he has not assigned an exposure, it is an observational study. And this observational study, if he has a comparison group or not. So if there is no comparison group, it is a descriptive qualitative study. If he has a comparison group, then you see where exactly the researcher has started. If both the exposure and outcomes have already started, then it is a case control study. If the exposure alone has happened, then it is a cohort study. So coming back, if the investigator has assigned an exposure, it is automatically an experimental analytical study. If it is a random allocation, it is randomized, and if it is not, it is a non-randomized control trial. So what is this level of evidence? So from the strength of the papers, so we have different levels. So level 5 is a very low level of evidence, level 1 is a high level of evidence. So the expert opinions and case theories, both are descriptive studies at the bottom end. Then we have cohort studies, case control, randomized control studies. These are analytical studies. And then we have systematic research at the topmost. So a meta-analysis of randomized control trials has the best evidence. So in conclusion, knowledge of a clinical study design and level of evidence is very essential to plan the appropriate study for your research question. Whatever thesis you are going to do or doing, you need to have the specific research question based on which you are going to have the proper study design from which you are going to get the best evidence. So again, if you are reading a paper to design the strength or utility of a published study, you need the level of evidence. Thank you.